What leads to cloudy urine? Urine will be cloudy because of the pus cells, or because of the bacterial contamination, or because of amorphous phosphates or urates, and also because of chyluria. Add a drop of acid. If turbidity disappears, indicates turbidity due to crystals. Now coming to the second question. What is low fixed specific gravity of urine? And low fixed specific gravity of urine is seen in low fixed specific gravity of 1.008 to 1.010 is found in end stage kidney chronic renal failure because of the loss of concentration of power of the kidney. As the kidney loses its concentration power, the specific gravity will be fixed to a point, and this point is called as fixed specific gravity, that is low in between 1.008 to 1.010. It is seen in end stage kidney disease, chronic renal failure. Coming to the third question, in which disease both the albuminuria and benzone proteins are present? Benzone proteins and albuminuria are present in myeloma. Kidney damages the glomeruli and tubulars, resulting in albuminuria and benzone proteinuria. Urine is first heated to 56 degrees centigrade. Benzone proteins are precipitated and they are filtered out. The remainder of the filtrate urine is tested for protein by heat and acetic acid test or sulfosalicylic acid method. Positivity indicates both to be present. So both albuminuria and benzone proteins are present in myeloma kidney. What is microalbuminuria? Sensitivity tests are available to detect the presence of very low amount of albumin, that is 30 to 300 milligrams or micrograms per 24 hours of the albumin in urine. This test is of use in identifying the cases of the early kidney disease, as in diabetes mellitus. Principle of testing glucose by multisticks. In the multisticks, they contain glucose oxidase, peroxidase, and chromogen potassium iodide. Glucose, when combined with water and that is oxygen, it will form gluconic acid and hydrogen peroxide. Hydrogen peroxide with chromogen will form oxidized chromogen. This is the principle of testing glucose by glucose oxidase in multisticks method. What are the kidney lesions that are seen in cases of diabetes mellitus with nephrotic syndrome? Usually, kidney biopsy reveals nodular glomerulosclerosis and or diffuse glomerulosclerosis. The disease in which sugar, proteins, and ketones are present in the urine. Uncontrolled diabetes mellitus. This uncontrolled diabetes mellitus will lead to ketoacidosis, ketonuria, and nephrotic syndrome. Crystals in urinary deposit and their significance. Calcium oxalate crystals are present in the urine and they will be envelope shaped. Triple phosphate crystals will be prism shaped or coffin lid appearance. Urates will be in needles or rectangular form. Crystalline triple phosphate made of calcium, ammonium, magnesium phosphate and amorphous phosphates, because of fine granular deposit, renders the pH alkaline and thus the urine becomes alkaline. The significance of crystals in urine is the type of crystals in the urine suggests the excessive excretion of that substance in the urine, and if it associated with stone in urinary tract suggests the possible type of stone. Moreover, crystals of uric acid or urates are excreted in the gout, and triple phosphates in urinary tract infections due to urea splitting organisms, making the urine alkaline. What is the difference between a hematuria and hemoglobinuria? Presence of red cells in the urine, smoky, is called hematuria, and it is observed in glomerulonephritis, malignant hypertension, and urinary stones, urethritis, and malignancy of the kidney and bladder. Presence of red cells is confirmed by microscopy of the urine deposit. Hemoglobin in the urine is present in the cases of hemoglobinemia and it is observed in cases of intravascular hemolysis such as paroxysmal nocturnal hemoglobinuria, paroxysmal cold hemoglobinuria, and in incompatible blood transfusions. And the hemoglobinuria is detected by Benzodiazepine test. What is Benzodiazepine test and what is its principle? Benzodiazepine test is positive both in hemoglobinuria and hematuria. Take 2 ml of the urine and add pinch of benzodiazepine powder and then glacial acetic acid and then freshly prepared 3% hydrogen peroxide. Dark blue color indicates hematuria or hemoglobinuria. Peroxidase activity of the hemoglobin acts as hydrogen peroxide leads to formation of oxygen radicals which combine with benzene giving a dark blue color. Glacial acetic acid lyses RBCs releasing the hemoglobin. Hydrogen peroxide plus peroxidase releases the nascent oxygen and water, and this nascent oxygen when combined with the chromosome benzidine it will form blue color. What are the causes of chyluria? What is chyluria first? Chyluria is milky urine, white colored urine. It occurs because of the ruptured dilated lymphatics into the bladder or into the kidney and lymph mixes with the urine. Confirmation of chyluria is carried out by taking 1 ml of urine and then add 1 ml of ether chloroform mixture. Milkiness disappears as the fat of the chyle dissolves in this mixture. Methods of testing the proteins in urine. One is heat and acetic acid test, the other is sulfosalicylic acid method, and the third is Heller's test where we use concentrated nitric acid, and one more method is dipstick method. In a case of hematuria, how will you know whether it is a glomerular or non-glomerular etiology? In glomerular hematuria, there will be two characteristic findings. One is red cell cast and the other is dysmorphic red blood cells. Dysmorphic red cells have discrete spheroidal protrusions, and these cells should be more than 5% of the urinary red cells. The glomerular diseases in which red cell casts are present are post-streptococcal acute glomerulonephritis, membranoproliferative glomerulonephritis, presence of isomorphic red cells in urine indicating a non-glomerular disease of the urinary tract. The diseases in which waxy casts are present in the urine are amyloidosis kidney and in chronic renal failure. What are the causes of the ketonuria? It is starvation, prolonged vomiting, eclampsia, von Girk's disease, diabetic ketoacidosis. Fatty acid in urine. When does one find fatty acid in urine? The answer is nephrotic syndrome. Calcium oxalate crystals are envelope shaped. And the final question, what are the urine preservatives? Ether, ethyl alcohol. To complete this topic, I want to add few more points. How would you stain a urinary deposit? Urine is centrifuged at 2000 revolutions per minute for 5 minutes, and the deposit is resuspended in a smaller test tube. 1 drop of crystal violet saffron stain is added to it and it is mixed. Examine under the high power with a low condenser. Very useful while looking for the hyaline gas, granular gas, candida, nuclei of pus cells, epithelial cells. Causes of hemoglobinuria, as I said earlier, paroxysmal nocturnal hemoglobinuria, paroxysmal cold hemoglobinuria, snake bite, incompatible blood transfusions, severe burns, March hemoglobinuria, black water fever, AIHA. How will you demonstrate malignant cells in a urine sample? Urine is to be centrifuged for 30 minutes and the deposit is taken. Smears of the urinary deposits are made and they are stained by Papanicolaou stain and are examined for the malignant cells. The other method is by urine cytospin.